My name is Keith Melvin, and today we're going to introduce you to a neat little bug called Pseudomonas aeruginosa. Now, I do want y'all to say hello to my little friend, Pseudomonas aeruginosa. Now, it's a very common nosocomial infection. Now, nosocomial infections occur in the hospital, and nosocomial is actually Greek for hospital. So this infection happens a lot with people who are already immunocompromised. They're already sick. Not only do we find this little guy in the hospital, but we also find him in the environment. He can live in soil, he can live on animals, and then obviously in humans. Now, people can pick them up as ear infections. We can get breaks in our skin and get infections that way. Like hot tubs is a common place to pick them up. Or if you leave your contacts in a little bit too long, you might be risking an infection in that route also. So let's take a deeper look at our causative agent, Pseudomonas aeruginosa. Now, it's a very opportunistic bacteria. So it's gram-negative, and got to remember that it's got a very thin peptidoglycan cell wall. So it's kind of sandwiched in between that cytoplasmic cell membrane and bacterial wall. Now, it's also an aerobe, which means that it does need oxygen to survive. Now, this bug loves moist places. Now, as you can see by the picture to my right, it does have a polar flagella, so it does make it very mobile and able to move around. Now, it's pretty small. It's only 1.5 microns, and it's not encapsulated. Now, strangely enough, it does smell like fermented grapes, or some people even think it smells like a tortilla shell once the bacteria actually became fermented. Let's dive deeper, my little buddy, and take a look at his family tree. Now, his division is a bacteria, his phylum is a protobacteria, his class is a gamma protobacteria, his order is a Pseudomonas, his family is a Pseudomonidaceae. Now, his genus is a Pseudomonas, and then we finally arrive to him as a species, Pseudomonas aeruginosa. So when we look at the modes of transmission, the number one way this bacteria still looks to get around is on caregivers' hands. Lack of attention to detail when wearing gloves, washing hands, using hand sanitizer in and out of the rooms, and just really not following infection control policies is still our number one way of spreading this from patient to patient. Now, the second part of that mode of transmission is really attention to detail by facilities and central services. Ensure that the surgical equipment is properly sterilized. Respiratory therapy is taking the appropriate steps when setting up ventilators, switching out circuits, and making sure that we're not cross-contaminating patients that way also. Now, we talked about the modes, but let's talk about the portals of entry. So mostly, we're talking respiratory tract. So things like ventilators that are growing bacteria in tubing, gastrointestinal tracts where it's been ingested, or breaks in the skin, mucous membrane, and again, those eyes. Now, there are a lot of risk factors that can increase your exposure to this type of infection. You have patients that are already compromised, so patients that may have severe burns, patients that have had surgery or other invasive procedures, patients that are on breathing machines or catheters, or some patients that are still undergoing chemotherapy. All these patients are already immunocompromised. Now, patients with diabetes tend to get infections a lot easier. Patients that have cystic fibrosis, which is already a lucky, can easily pick up Pseudomonas aeruginosa because of the treatment they undergo and those types of things. Obviously, HIV patients are already immunocompromised, and really any other medical condition that would immunocompromise patients at the time of hospitalization sets them up as a high-risk factor. So once patients are really sick and the bug's got the opportunity to attack, UTIs with catheterization is a great way to pick up this infection. Lumbar punctures, patients that get tracheotomies put in, and anybody that just is really in the hospital get really septic, where the infection starts to break down your vasculature, and you start having a complete organ complex collapse. So now look at how we detect Pseudomonas aeruginosa. So we can perform an OF test, and that is really to differentiate between whether or not bacteria will produce an acid from carbohydrates under an aerobic condition. and that's not a fermentive bacteria that produces acid under both aerobic and anaerobic conditions. Now there's also the catalase test. And in the catalase test, we're really looking to see that with the catalase enzyme neutralize bacterial effects of hydrogen peroxide and protects them from anaerobes that generally lack the catalase enzyme. And here we can see that with this bacteria, that would be positive. Now the oxidase test is another test that we can perform. We're really looking to see if bacteria produces cytochrome deoxidase. And with that, you're going to have either a little strip or a little region, and it's going to turn a dark blue to a green color when it's actually oxidized. And that will let us know that the bacteria is actually positive, which we see here also. So nitrate reduction test, we can see here that it's positive. Basically, with anaerobic metabolism, it requires an electron to accept that oxygen molecule from somewhere. So a lot of the gram-negative bacteria will use nitrate in that final electron. So it'll test to determine whether or not an enzyme called nitrate reductase is actually present, which is what results in the reduction of the nitrate. Look at the signs and symptoms in patients that are infected with Pseudomonas aeruginosa. Let's kind of start with some of those skin type things where you can see down below there's a little bit of infection. This guy might have had a hot tub or something like that, but it's just painful and itchy. Rashes can form, they can be pus-filled, like a greenish discharge. Actually, it's kind of gross when you look at it. Now, the respiratory infection in the lungs usually will start out as a pneumonia, and that can progressively get worse. Bugs can become a little bit antibiotic resistant. So, they'll start developing fevers, respiratory distress, they'll start losing their blood pressure, their heart rates go fast, and the patient starts to develop some mental confusion, eventually leading to sepsis. Once you become septic, you become susceptible to death easily. Now, the final one we mentioned a little bit earlier with signs and symptoms would be the eye. This is commonly occurs in patients that leave their contacts in, and they'll develop a bacterial infection. Pseudomonas aeruginosa is one of them that you can develop from that. Now, this can lead to permanent blindness of the eye and not being able to resolve and get the vision back even after antibiotic treatment. So when we start looking at the treatment for this infection, you got to remember that these patients were already sick patients. They needed supportive care to begin with. So you're going to have to put them on some pressors for their blood pressure, to keep their blood pressures up, fluids to replace the fluids that are leaking into third spacing, water glucoses, managing respiratory system. There's a lot of things that they already needed in supportive care for a treatment. So now that we've got the supportive care taken care of, then we start looking at doing antibiotic therapy. Now, we want to be careful not to do broad spectrum and kill the natural flora. So we go after things like tobramycin, gentamicin, colistin, amikin. Those are ones that are pretty successful. However, we do find some strains of Pseudomonas aeruginosa that are antibiotic resistant to even some of those heavy hitter antibiotics. Identifying the main cause of spread as being medical providers and nosocomial infections, we really got to focus on infection control policies and procedures, washing our hands, not cross-contaminating our patients, using gloves appropriately, making sure that things are sterilized appropriately, that we're going through sterile procedures. Really, it's upon us to stop the spread. It's going to benefit our patients, and in the end, that's what's going to win. Well, thank you for gathering today and listening to this presentation about Pseudomonas aeruginosa. I do want to send a shout out to State Technical College and thank the microbiology department for an awesome semester and really helping us dig deeper into some of these bacteria that make such a difference in hospital patients every single day.